I work for an organisation called NHS Diabetes and Kidney Care, who are the supporting improvement body who support the national programme of NHS Health Checks, which I'll talk to you in a moment about. Firstly, I have to say thank you, and I think this is huge dedication. It's kind of, where are we, 3 weeks away to Christmas, and it's a kind of afternoon where I thought people would suddenly be off shopping and kind of getting some shopping time in. So thank you for staying, and hopefully you'll find this session useful. Equally, you might wonder why suddenly the room looks very different, and you're now in kind of circles or semicircles with flip chart paper by you. And whether that's fortunate or unfortunate, the reason is because you're going to do some work. And I was told with the spec for this is to keep it lively and to get you guys doing some interactive discussion. So yeah, I'm going to talk to you for a little while, and then there's going to be some group discussion, and I'm going to ask that somebody in each group is a facilitator and captures some information, and somebody keeps the time, and then somebody feeds back. So start thinking who might want to take on those roles. The first question I've got for you is, I spoke to some of you in the breakout area, but was how many people are actually familiar with health checks? Is it something that you've come across within your current sphere of work? And if it is, put your hand up. Okay, so we've got the kind of the I think you guys sit in the minority, and so the rest of you are largely unfamiliar with the programme, and that's useful for me in regards to the content and what I'll discuss and describe to you. The title of the presentation is around the challenges and the opportunities for the NHS Health Check programme, and as I'll soon describe, this is one of the key mandated programmes that will move to the local authority from April, and there are huge challenges with this, and one of the earlier presentations this morning, I really liked that kind of ethos of let's just get on and do it. But I think it equally gives us huge opportunity and to think about how we enhance and improve our public health services. And I think there's much to be said about that, and that'll be some of what I'm going to ask you to think about. So the overall objective of our session is to think about some of those key challenges, but opportunities of when this programme moves into local authority, if not in some areas it has already pretty much is well on its way of doing so. So for those of you who are not particularly familiar with NHS Health Checks, the policy was originally described back in 2008, and it was a Labour initiative and a stud test of a coalition government, and has continued. And the first document that really described the policy was something called